Hello everybody, this is Dr. Kalpana from Hamilton Bailey Hospital, and I have been practicing obstetrician and gynecologist from past 15 years. Before that I would work with Dr. Vidyamani at an IVF center and a maternity home. With her I was for almost 5 to 6 years, and I was abroad in Kuwait for about 10 years, where I worked as a senior resident soon after my post graduation. As of now, I am at Hamilton Bailey working as a high risk obstetrician and also promoting natural birth. If you're looking at only gynecology, in India, I think there is a lot of work which can be done still, because most of them are unaware of many problems that they go through, and they take it as just natural, and they don't come to us for any sort of checkup or any problems. What has happened in gynecology is that, of course, we all know about the robotic surgery, like the technology has gone ahead so much, and we have the laser surgeries where we precisely work on the spot as to where really things has to be done. So this way it has really worked on, and also the surgical part, it has improved a lot with the skills of the gynecologists who've been doing with the laparoscopy which has come in, and the cameras, very good cameras which have come in. So these things have really helped us to go ahead. I'm very happy to tell you all that in urban areas, especially the youngsters, have become very aware for various reasons about their menstrual cycles because of the lifestyle they go around, and they don't want to know about their ovulation as to when it is happening, and so they all have this app which is very much aware, which is available on your stores, where you can just download and say, okay, this is when I'm going to have my menstrual cycle. And they do have apps for ovulation to know when they have to really try for a pregnancy or not have a pregnancy. So that way they are so aware of all these things. And once there is, I've seen clients who come in saying once they have missed their cycle, they are a little concerned as to why. So this is helping us to pick the PCOS patients or women who are in early pregnancy, and it helps for them to take a decision and change their lifestyle and go ahead. It is unfortunate that in the urban area we see PCOS as to about at least 40 to 50%. Yeah, and this is because of the lifestyle change which they adapt, and most of them, especially in Bangalore, what I see is they are all working women who come from outside Bangalore, and they live in a place like a PG or elsewhere where, one, their diet is not all right. Second, their working hours, you have the American shift and the European shift. The sleeping habits go away. There is something called a circadian rhythm in us, as it is a physiological thing which happens, where it says you have to sleep at the right time and get up at the right time. But what is happening in the urban area is that you sleep at odd times, eat at odd times, and plus the stress levels at the workplace, the targets what they're given to them, and for them to really work upon that. And apart from that, their relationships which they try to balance out. So everything is playing a role. So they forget that they have to have a holistic approach to their life, which involves your diet, your exercise, your sleep, your emotional quotient, and your spiritual part, if at all they are going ahead with something like that, and the mental part. So these things play an important role, And of course, when they come to a doctor, we as, at least me, I myself, I touch upon all the five things so that they understand what it is, and they try to change their lifestyle. So this is something we have been seeing in the urban area. And this causes a lot of hormonal changes. That's the reason why all this happens. Okay, as long as the gynecological care, you're talking about the teleconsultation, that of course is helping because of the urban area. You know, there's a lot of traffic. You take a lot of time in traveling, maybe hours together. So this would definitely help because they do not need that urgency. Gynec clients, they can be pushed because it's not an emergency, but the shift on home based for the pregnant women, it really makes a big difference because they also have to travel this whatever I just mentioned. And also if we can do the monitoring by the apps, actually there are certain apps where they can actually trace the NST or even the heart rate from the app, and they can actually send it to us, and we can tell them whether they are fine or no, and have a teleconsultation and talk to them, and so that saves them from coming to the hospital. And one exposing them to the infection is one, then the travel is the other, the stress is the other thing, so all these could be avoided. As far as urban settings, I would say that there's a lot of programs from the Rotary Club and other places where they make the children aware that that the HPV vaccine is very important for them. And I have been attending to one or two of them, so they do a wonderful job telling them what HPV is and how it helps, how the vaccination helps, and things like that. So there is a drive for awareness by most of the clubs and few of the NGOs. So that is happening in the urban area. As far as the rural area, I'm still not very aware, but they are not very aware of these things because as far as the HPV vaccination goes, the awareness is becoming more in the urban parents, but the pap smear is still not that aware. They are not aware of it that much, especially in the rural, because the education is not there. So that needs to still develop, and they need to still actually do a lot of work in that area and make sure that the women are aware of pap smear and the mothers and the parents are aware of the HPV vaccination. And as far as the doctors are concerned, they should educate the women who come to them about all this. This would be definitely helpful because if you are a very busy gynecologist, and you need to see the patients and you do not have the time for the patients, this remote monitoring definitely helps. And we do have a lot of apps like which will help them to do it by themselves at home, and actually educating the client with this would be much better thing, so that they will also be aware and they would come back to us on this, and it would really help us in this. I would start with saying that mothers or the women in the house or the family, they do not take care of themselves. They are so caught up with taking care of others that they just ignore themselves and they don't come to the hospital, most of them. Uh, of course, now the awareness is starting because the youngsters, as they grow old, they understand that there's a perimenopausal and menopausal, and we need to take care of things like that. But the older people still are not aware, And this, of course, we need to bring in awareness through our programs which are there, and we should be able to make women come to us so that we could treat them not just for the menopause, it's also for their other things like the bone loss, the bone density, and how to take care of themselves, and how well support for the emotional thing which they go through, like the emptiness syndrome or things like that. How they can cope with such things, because most of the family goes away at this time for them, and how do they really cope with all this is something they should understand. And there's so many methods of supporting them emotionally. They can do the relaxation, they can do yoga, they can do meditation. There are plenty of ways, and also a holistic approach to a perimenopausal or a menopausal woman definitely helps, rather than just giving them a hormone replacement therapy. So that way it is important that she understands that even she needs a shift, because these are all natural things which happen in a human being. So they need to understand that this process is a part of their life, and how they can actually go along with this is something they need to learn. But actually, what has happened is Sudha Ramamurthy has brought up this HPV vaccination in the parliament. So hopefully that government will make it free for all the girls and the boys. Both of them have to take it. It's not just the girls taking it. So both boys and girls have to take it. And I hope it will come as free, because it's a little on the expensive side. So hope it will come as one of the routine vaccination which will happen